Well, I'm very excited to have Dr. Michele Tosin today. We're going to talk about the Young Member Paper of the Month for December 2024 that she was the first author on. And knowing a couple of Brazilian words, I'm going to start off with Oi, tudo bom?
Oi, tudo bem?
Right. We loved your paper and you gave us a great summary for the moving along, and I urge everyone to read the paper in detail, of course, but just very quickly, what was the take-home message from your study?
Great. So, with this study, our main goal was to develop an instrument that could be used for patients and their care partners when the telemedicine was performed, and the clinician would need to perform the whole motor examination using the MDS-UPDRS. The main takeaway of this study is that we believe that facilitating telemedicine by using this guide from the patients and their care partners, but also the clinicians, could greatly enhance the care of patients living in resource-limited settings, and would also give more confidence that what the clinician is doing with clinician, the assessment the clinician is doing with them through telemedicine is the standard of the assessment that they are doing when they are in an in-person consultation. So the main takeaway is we have a guide now we can use together as a clinician, as a patient, as a care partner, so that we can have your assessment and your evaluation done in the best in the best way.
Mm-hmm. And you mentioned there were phases in your study. Did you have any strategies for each phase? Were there any surprises you encountered in each phase?
Yeah. So when we were developing the project, we knew that we would need to implement a mixed method approach, where in each phase we would be implementing different techniques to collect the data. So in the first phase, for us to design the instrument, it was important for us to have uh, people and professionals, specialists in movement disorders, but also professionals that were aware about the necessity, the needs of the patients when performing a telemedicine assessment. So that was very important. The selection of the group who would be in designing the first draft of the instrument. Then, in the second phase, the cognitive pretesting, it was important to have a good way of listening carefully all the details that patients and care partners could bring to us in terms of the instrument that was developed by specialists. So we made sure that we would capture all their thoughts about that instrument and use that information to refine the instrument. When we did that, we were able to go to the third phase, which is the guide translation. So we did the forward and back translation of the material, trying not to develop an instrument that was too wordy, because the main reason why we are using pictograms is that we want this instrument to be used all over the world with less work to be done in terms of translation and cultural adaptation. The fourth phase, the last phase, was the usability testing. So with the instrument, after the development, we tested with samples of patients in Brazil, in USA, in China, and Spain, Canada, and we asked them to tell us how was how how was the experience using that instrument, and we also asked for the clinicians to tell us how was their experience in seeing patients using the instrument, using the guide. With that, we had a good surprise when we saw that the Chinese people, in Taiwan, they were not so used with using telemedicine, and they made clear in their responses that they still prefer the in-person consultation, and that the guide would not be so useful for their context, as they still prefer the in-person consultation. So highlighting that culturally, this is something that works better in some places than others. But although this is something that we know now, we know that technology is improving and things are getting involved. So maybe in the future, this guide will have a better acceptance by this population, for example.
Do you have any tips you can share for getting a publication submitted to Movement Disorder Society journals?
Yeah, so I can say that I'm used publicating in the movement disorders journals, and comparing with other journals. The movement disorders journals are not so strict in terms of their template for the manuscript, on how we should be reading in comparison with other journals, that we need to have a specific font, a specific template of the page. So with the movement disorders, it's more simple. We need to know what are the sections that we need in a paper for them to review it, and because of that, we can have a template ready in our computer, and every time that we are writing a manuscript for these two journals, we can use this template, and the more we publish there, the more fast and easy is to do it. So simplifies the process to have a template.
Well, thank you so much. I'll also give a shout out to the clinical outcome assessments group we have at MDS, because I'm sure they were pretty involved with this project too. And they will be opening up applications coming soon, and please consider applying, especially if you're a young member. They're very eager to have young members working in that group. Well, thank you so much. Parabéns. Looking forward to the future publications.
Thank you. Obrigada.